Dr. McDonald, from a psychiatric perspective, dealing with kids, how do you view the idea, the whole notion of the masking in school, forcing them to wear those? Have you seen negative ramifications from that? And do you think it's a good thing to force masks, or do you think it should be mask optional in K through 12 schools?
Thank you, Governor. My position is simple. Masking children is child abuse. There is no evidence to support the contention that masks prevent the transmission of respiratory illness through viruses at all. And there's substantial evidence that shows that children have been medically, physically, and psychologically harmed by mandatory mask mandates. I said this and I maintain this position from last April of 2020. And I continue my position today unchanged. In fact, I even reinforced this position. I've seen hundreds of children in the last year come to my practice who are coughing, spitting, sick in the throat, streptococcal infections, conjunctivitis, impetigo, allergic reactions, panic attacks, all from masks. Not a single child has benefited medically from wearing a mask, and they've all been hurt. I had one come into my practice last week. He's been in lockdown in his home for over a year. He has anxiety. He hasn't been able to play with his friends. He hasn't been able to attend school except through Zoom. He's attached to a keyboard. He brought the keyboard with him. He wouldn't look me in the face. He was wearing a mask in my office as it was his mother. She told me that he can't attend sleepovers now. He's not able to leave her to go to play therapy. Why? Because he has to wear a mask. And if he takes the mask off, he becomes scared. He has separation anxiety. My autistic patients are even worse. They can't wear the masks. So when they take the masks off, they have to leave wherever they are and go back to their home because they're not able to fly, they're not able to play, they're not able to attend their theater groups, their sports. I am appalled that we're even having this discussion. Every thoughtful, rational adult knows that children do not need to have their faces covered. More children died of influenza last year than ostensibly died of all of the variants combined. And yet we never asked children to wear masks during flu season. Why are we asking to wear masks now? There is strong evidence, even as of last week, when Dr. Marty McCary published his report in Johns Hopkins Journal, after studying 44,000 cases of children supposedly infected with this virus, not a single healthy child actually died from it. All the deaths were in children that suffered from severe illness such as leukemia or morbid obesity. We have studies as early as April from last year out of Germany and Lower Saxony that show that children in schools not wearing masks actually helped prevent transmission of infection to their teachers, who were worse off when their teachers were staying at home with their own families, i.e. children are actually a sink to the transfer of infection. They do not transfer infection to adults. They do not get sick and die themselves. So the only valid argument to make for masking children is that it protects them or it protects adults. Neither is valid, neither is substantiated. On the other hand, there is substantial evidence that they're being harmed physically and emotionally. Depression and anxiety have gone up 300 and 400% in the last year. In the 4 counties in Southern California, the coroners showed teenage and child suicide increased between 2019 and 2020, year over year, increased. Mental illness is a catastrophe in this country, primarily due to lockdowns in children, but the masks is not helping. The masks are nothing more than a symbol of fear and anxiety. They do nothing to help us medically, and they're destroying our country, and we need to take them off of our children's faces, and we need to let them roam and breathe freely.
Have you noticed, you go back pre-COVID, kind of kids go to school, kids play, it's just kind of normal. And then with COVID, obviously there was a lot of places in Los Angeles, a lot of kids couldn't even get back into school in person. But then even in areas where you had it, they're basically being taught, and the mask is the number one symbol, to view themselves and each other as primarily vectors of a disease rather than kind of just human beings. Have you seen that, and what ramifications does that have for their upbringing?
Well, this has become a medical apartheid state. You have people who do not wear masks, and you have people who do wear masks. And those who aren't wearing masks, and I'm pointing specifically to children in this case, are viewed as dangerous, or are viewed as immoral, or are viewed as non-compliant. In other words, they're bad. So even children who don't want to wear masks, who are forced to wear them, feel terrible about this, but they don't have any choice, because if they don't wear their mask, they're ostracized. Children cannot coexist, in my city anyway, with mask mandates if they don't wear the mask. And even without the mask mandate, there are still some women, mothers, fathers who will not let their children play with other children who don't wear masks because they think that the masks, without the mask, their child is going to make them sick. So it really is a kind of a stain. It's a sign for other children to note that when you have a mask on, you're a good boy or a good girl. And if you don't have it, you're not. And I think that that's a very important, visible symbol of separation that we underestimate. A vaccine is one thing. You don't see a vaccine. And unless you disclose the information or are forced to, nobody knows if you have a vaccine. But you certainly know if you have a mask on. And kids see that right away. And when kids see other kids with masks or without masks, they make judgments, they make opinions, and they behave in concert with them.
So, anything do you think that needs to be mentioned going with this?
Yeah, I think I want to completely agree on the harms of masking, right? We sometimes in the epidemiology community and other and scientific community, we've talked about masks as if they were a costless intervention. The psychological harms are real, the developmental harms are real, and the fact that there really is, not everybody, but a very substantial number of people that really just don't like them, we have to take that seriously. Like we shouldn't just treat that as if they were a nothing. And I'd ask fellow scientists and other fellow epidemiologists that work on this to think about that just because you think that other people should just adopt masks as if there were no costs, you have to listen to people. Like you have to listen and hear what people are saying. These are real costs to them. And not just dismiss that as if it were an easy intervention that automatically will address the epidemic. It's not true that if 90% of the people wear a mask will end the epidemic. That 90% of the United States actually reported wearing masks last year. We didn't end the epidemic, and there's lots of harms. I think those are real. We should take them into account.